Hey all, my name is Pete Croft. I am a assistant professor of emergency medicine up at Maine Medical Center. Thanks first off for listening and viewing this short proposal. I've actually had this in the works for the last few months and waiting for the right time to propose and the right avenue to do this. It's difficult at times being up here in Portland, disconnected from the administration and staff down there at Tufts. So I thought this would be the best network to do this most effectively. So right off the bat, thank you so much for putting in the time to listen to this. I co-direct the ultrasound program up in the emergency department at Maine Medical Center with one of my colleagues, Dr. McKenzie. So I wanted to go over slide by slide some objectives and essentially talk about some of the data behind and evidence behind integrating ultrasound into a medical student undergraduate medical education curriculum, where this comes from, what it could lead to in the future, and how it does indeed benefit students and essentially make them better doctors and clinicians. An immediate vision, my my goal is to assimilate the ultrasound program and ultrasound lessons into the physical diagnosis course that is already established at Tufts Medical School. Ultimately, anatomy. I think these two, in particular, have been borne out at other institutions as being the most or the highest yield education for the students, and something that we can absolutely reciprocate and build upon from previous institutions. Also, have a vision of utilizing web-based tools. I do this now at the emergency department at Maine Med. A lot of online education with ultrasound is very hot these days in the last few years. Free open access medical education, or if you're heard of FOAM before, this is very popular with ultrasound in particular. Due to many students, especially in their first few years, being in Boston, some being up here in Maine, this ability to webcast and stream videos and education is really paramount. We use tools such as Dropbox and YouTube. We have a YouTube channel up here at Maine Medical. Also, immediate vision would include a stimulation of self-guided sonographic hands-on learning. This in particular to develop some entrustable skill sets using ultrasound for the medical students themselves. Ultimately, a 5-year vision would be to provide an advanced elective, which I was a part of back in 2009 at Ohio State, for fourth-year students interested in ultrasound-heavy fields. You know, this is fairly diverse and flexible. The advanced course I was involved in at Ohio State had folks from these avenues: radiology, internal medicine, anesthesia, but also folks from pediatrics. Anyone who is interested in ultrasound was in this course, and this was in a longitudinal course, meaning that there was complete flexibility and not just 1 month of dedicated time. It was throughout the entire year, which we were able to weave ultrasound into the curriculum. And you know, the ultimate goal is to enable every Tufts medical student to leave their school and enter their residency, whichever avenue they're going on, with an electronic portfolio. I think this is incredibly valuable to walk into a residency having already done 25 FAST exams, 25 echocardiograms, 25 pneumothorax evaluations, basic ultrasound tools that every clinician that's working in the hospital on call at night can be used to help manage and identify shock and assist with resuscitation. These skills, having this going into residency, make students, or would make students, incredibly valuable and attractive for residency programs. And that's my ultimate goal with this project, is to be able to provide that to medical students at Tufts. So a little bit on the work done so far. here are just some of the institutions already instituting an ultrasound program. As you can see, it's becoming more and more pervasive by the year. More and more institutions and medical schools are implementing ultrasound into their curriculums. Many have it in a 4-year curriculum. Some are just starting, like us here at Tufts, just weaving it into the first year and learning as we go and where it works the best in this particular curriculum. There's a good amount of evidence and articles and research produced on this. Here's just a few looking at how ultrasound has been integrated into the curriculum at Ohio State, where I actually trained. Dr. Boehner is quite a leader in this across the country. I've been in close touch with him as I developed this curriculum. He's been quite a mentor for me individually. This just recently came out last month. This is an American Academy of Emergency Medicine. This is actually one of their position statements, and they posit that ultrasound should be integrated into the core curriculum of undergraduate medical education. This comes after years of debate on this and evidence, some of which I just showed you, but also just the understanding and an identification of a need for medical students to carry at least a basic knowledge of ultrasound into their residency programs and the diversity in which they do so. So let's go over some strategies with objectives. We're going to do a quick introduction. I'm going to discuss how I'd like to coalesce ultrasound with the physical diagnosis course, as well as by using some online didactics and not a heap of classroom time, much at all, actually, to accomplish this, as I know that is extremely valuable, as well as talking about how an assessment is going to work out. So integration into the physical exam course, year one, I envision an open lab session before any of the modules takes place. This can come anytime before Thanksgiving break. From really scouring through the curriculum, it seems like Thanksgiving is where they have one of their studying would be six in particular that I've identified to be the highest yield. Bottom, South Carolina, if you read that small quote there, again with Ohio State, actually before Ohio State, one of the preeminent medical schools in the country that have been utilizing ultrasound, and they certainly have a 90% of their students have been very pleased, at least over 90% with their ultrasound education. Using and implementing it into the physical exam or diagnosis course has been shown to be quite effective. This was down in Loma Linda out in California, and showed some increase and improvement in physical exam skills by utilizing ultrasound in their assessment of patients. There's a lot of flexibility here too. That's the beauty of it. There's so many different ways we can use this and really test our students and test their idea of their physical exam and then ultimately anatomy in the future. What I envision is before each module doing sort of a flip the classroom, and this just will empower them to to learn on their own and to prepare on their own before each module, so they don't come in completely empty-handed and completely unaware. I do this with our residents at Maine Medical, and each one of these are about 10 minutes long, which I find to be a good length in terms of captivating students and keeping their attention. So these are short, focused lectures, anywhere, anytime, which is the beauty of it. Here's one quick example of it. This was an ultrasound of the eyeball that I put together for our
Hey guys, I had a few
residents.
Requests to go over ocular ultrasound and in particular retinal detachments.
I'll fast forward
in the
to
last few weeks. I put together a small eye is that it looking at. The beauty of using the Tegaderm is, and you can tell this to your patients, is that it doesn't rip the eyebrows off, nor does it rip the eyelashes off. It's a pretty image, and then to translate it to what you're looking at with an ophthalmoscope, this is a normal retina and posterior.
So it's just a brief example. Other ones that I've done with our residents include the gallbladder, DVT studies, heart cases, and so forth. So it's a great avenue, and it's gotten some good feedback, and I see that as a great way to coalesce the distance from students in Massachusetts and Maine, and help with their education in that regard. And the TUSK, the Tusk website, would be where I think I would utilize this option of lectures. Again, just with the geographic constraints, it's a nice way to reconcile that. So let's quickly go over the modules. I won't go into this in mind-numbing detail, and I won't show you images on each case, but just to kind of give you a preview of what I was thinking, here are the 6 modules that I thought would be the highest yield for our ultrasound education. Let's go over the back first. So, I think a great utilization of ultrasound is and especially in the emergency department and on the floors in the ICU, and neurologist is using ultrasound for lumbar punctures. This also helps with landmarks identification. It helps especially in obese patients, which many of our patients are these days. It can really expedite and decrease the amount of sticks that you're doing. So also for the lower extremity, which is in this block, is identifying tendons. The highest yield is patella, quadriceps, Achilles. Very easy to obtain, easy to teach. Also the femoral triangle, which is so paramount with code situations, nerve, artery, and vein. And then I think a great one is the DVT study. And the reason why this would be so good is because it can correlate with leg swelling in a patient that comes in with unilateral leg swelling. The difference potentially between that and cellulitis is another great way. You can use ultrasound and a great way to coalesce that with the physical exam course. Next off, cardiovascular for sure. This one's across the board has been shown to be really useful. Interestingly, in 2005, the American Journal of Cardiology published a research study showing that medical students, after brief echo training to detect valvular disease, which is a little above and beyond which I even am proposing, an LV dysfunction enlargement, were superior to that of experienced cardiologists performing cardiac physical examinations. Again, this is just to reiterate that ultrasound and the physical exam with stethoscopes can be used together, and in some points, in some instances, actually improve the diagnostic accuracy. So what I envisioned is going over some ejection fractions, a little bit on valves. I think that's really important, especially with murmurs, and then talking about effusions and tamponade, the difference between the two, and why ultrasound can help you with a patient with potentially clinical tamponade and JVD, and pulsus paradoxix. Pulmonary is a terrific one and very easy again to teach. Lung sliding, ruling out pneumothorax with an ultrasound has been shown to be superior than a supine x-ray in a trauma patient. This would be highly applicable to surgeons, ICU, medical students that are wanting to do critical care, internal medicine that are going to be dealing with people on ventilators, emergency medicine people, diaphragm identification. Pulmonary edema is huge. Diffuse B lines. It's going to be a good way to assess and reassess patients with volume overload and diuresis. And pleural effusions are a nice adjunct to this. Would be a nice adjunct to this module as well. GI and GU module, identification of a AAA, certainly high yield for family medicine folks, internal medicine, emergency medicine. Hepatobiliary is great for anatomy, reconciliation, signs of cholecystitis, the Murphy sign, identifying gallstones as opposed to polyps, and renal and hydronephrosis and obstructive kidney failure can be certainly identified very easily with ultrasound. In terms of the neck, that's a great one as well. We can go over the internal jugular vein and carotid artery. The thyroid is beautifully seen with ultrasound, and that has a lot of adjuncts in terms of structure and pathology. Ophthalmology, I already showed you that short tutorial. Retinal detachment, vitreous hemorrhage, identifying the lens and the optic sheath, all of these things. The eye is such a beautifully sonographic structure given its fluidity and superficiality on the face of the body and on the body. It's one of the most easy and beautiful structures to visualize. It really bodes well for sonographic imaging, and it's typically a very high yield topic and provides a lot of interest and excitement for students. So here's a format that I was envisioning, and of course this would need to be ironed out with Drs. Colangelo and Darvish who are performing and doing this course. But each diagnostic block has an A through D group. So what I would envision is implementing or having ultrasound involved in each of these blocks in some way, whether that's splitting the students up in groups and having them rotate through the ultrasound portion of the evening, which can be 20 to 30 minutes, or we could figure out some other way to do that. But we would need to have about 2 to 3. I would envision 2 ultrasound facilitators per block. Again, this I think is going to be the best avenue to do this, and shows the most promise and applicability for the medical students learning. Of course, we need to do an end of the curriculum assessment. This is flexible. I've looked through a lot of the medical schools data so far, and they do this with online assessments as well as self-assessments from the students. This will just give us the ability to assess ourselves and see what we can improve on and do differently from year to year, and what the students are really craving and what's working and what's not, which I think is absolutely necessary in something like this. In terms of hardware, I've already had some attention with Sonosite and Terrason. There's lots of options we can go with this. I see 10 to 15 machines being probably the amount necessary to really get a good education for the students. These blocks for the physical diagnoses course are typically about 50 students per block. So if we were to have 10 machines, I think that would be probably just the perfect amount. 8 to 10 machines even would be great for that. In terms of software, we here at Maine Medical and at the Simulation Center, at the Hannaford Simulation Center in Portland, we use a product called QPath. We're just about to start using this, as a matter of fact. Where I trained in ultrasound down at Mass General in the ER, we had QPath there, and it's extremely effective way that we can record and assess students and resident videos and clips of ultrasound and provide with instantaneous real-time feedback and analysis. It also is able to compile data for the students and ultimately make a portfolio for them so they can actually easily sort through and figure out how many exams they have done and how many they need to do for each particular subset. One of these, the goal would be to have just add another licensure down at the Tufts Simulation Center to allow QPath to be able to obtain images and down there in Boston as well as up here in Portland for the students. Ultrasound interest groups are important. I was in one at Ohio State back in 2006 starting. Um, Many of the schools involved with medical education using ultrasound have an ultrasound interest group. They're a great way for students to not only get some dedicated and special and advanced learning with ultrasound, but also the ability for them to teach one another once they kind of graduate from year to year. Um, that's been shown to be helpful in a number of ways. Once they're learners and then they become teachers of ultrasound, it's the best way for them to really get a good sense of the technology. Social media, I mentioned earlier, FOAM, Free Open Access Medical Education. This is used across the board on Twitter, and it's a great way for students who are moving more and more towards podcasts and shorter education modules for them to gain some leverage and information with ultrasound. Faculty time, mentioned already, Dr. Darvish, as well as Dr. McKenzie, my colleague up here, Dr. Owens, who's been up here for 25 to 30 years at Maine Medical, who I took over for running the program with the emergency residents, would certainly be involved. This is kind of where we would need to do some work in terms of identifying some motivated, diverse faculty down, especially in Boston at the Tufts program, to empower them to help out with some of these modules. For instance, on the cardiovascular month, it would be great to have, excuse me, a cardiologist come for those sessions just once a year and provide their expertise and knowledge in terms of echocardiograms for the small student groups. And along those same lines, on the pulmonary night, having a critical care doctor or pulmonologist that uses ultrasound, which we have some up here in Maine, but it would be great to identify a few down in Boston as well. And I would need certainly Dr. Epstein's help identifying this consortium of physicians. But really, the beauty of it wouldn't entail a ton of faculty time on their end. Potentially just a few evenings a year would go a really long way in providing great education for the students. So I mentioned this before, integrating it with anatomy and the core clerkships, and then offering a fourth-year advanced ultrasound elective. Anatomy here, a few quotes, and I'll let you read these rather than speaking over the screen recording. And in terms of core clerkships, this is probably the most highly variable integration that I've seen from looking at the individual schools across the country in terms of how they incorporate it into their family medicine clerkship or their internal medicine clerkship. There's a ton of flexibility here, and this is something that we could talk about down the line. What it does do is it enables students to use the knowledge from their first and second year in anatomy and physical diagnosis course and put it on real patients in real time on the wards, and really empowers them to utilize the skills that they've learned in their first 2 years as they move forward and through medical school. This advanced ultrasound elective, what I envision is a longitudinal one, and again, we can talk about that in the future. Dave and I up here at Maine Medical have a bedside ultrasound elective for students interested in emergency medicine starting off in September, and we already have students lined up for this year. So it's a step in the right direction, and this would certainly augment this program that we're trying to get going here. And then lastly, throughout the course of the fall and the winter, I would incorporate some open lab time at the simulation center to allow students to use machines in their free time and to practice and to obtain images and to help improve their portfolios. I mentioned research before. I think that's imperative for us to accomplish. And then also self-assessment every year to do an introspective review of the faculty, with the faculty, determine where to move and how to move in the next coming year. So thanks so much for listening. I realize that your time is precious, so I really appreciate it. If you have any questions, please email me. There is my Twitter handle. It's purely medical, only ultrasound related topics. So please feel free to join that and follow that. And I really look forward to working with you and hearing from you in the future. Thanks so much.